I've just come from our peripheral neuropathy scientific session here in Vancouver at the AAN to learn quite a bit. A lot of things mechanistically, very mouse-based, but then there are some nice papers discussing other issues, including pain in Charcot-Marie-Tooth, to emphasize that there are a significant but small number of patients who have pain, and this is from a group in Vanderbilt, Dr. June Lee's group. But at the meeting, I've seen a lot of other very interesting things. I saw a poster from here in British Columbia highlighting in young persons the utility of genetic testing. And so they looked at, over a 2-year period of time, patients who had an idiopathic epilepsy, and their ages went into the 20s but had very young infants as well, to find an extremely high hit rate for DNA testing, and specifically about 27% hit rate for definite diagnoses. They also found a number of variants in known genes that cause epilepsy that had not been described in other persons previously, so some indeterminate results in about a third of the rest of the cohort. So that is a very exciting observation, I think, in a large group, and will emphasize the need to do comprehensive or even focused approaches in genetic epilepsy. So lastly, we were able to present our work regarding the targeted genetic testing in inherited neuropathies, which basically outlines a very significant positive hit rate among patients who had failed traditional approaches, that is candidate gene testing earlier. And so specifically 17 of our 93 patients who had failed all earlier testing were able to have a specific diagnosis made. So that was very rewarding to be able to share that with our colleagues. One of the questions I thought was a good question was, although it generally favored and helped those people who are younger, what about those that we did find that were older, and was there anything specific about them? Unfortunately, I can tell you there is nothing specific about them. They look like garden variety link-dependent neuropathy, which I think again emphasizes the utility of a comprehensive approach from we can't distinguish, even with our best clinical testing of bedside testing, what the cause is. So good questions, very nice time here. I've learned a lot myself, and I'm excited to go back to Rochester and tell everybody about it.